Thank you, Mr. Chairman, for your leadership on this committee to hold Juul and other e-cigarette manufacturers accountable for what is an urgent public health crisis. I am heartened to see the bipartisan interest and commitment to address what is a fast-moving outbreak, and am hopeful that we will show similar and equitable outrage when it comes to gun violence, which is also a public health crisis. Dr. Schuchat, thank you for being here and thank you for your efforts in addressing this outbreak. I wanted to just revisit the line of questioning from Representative Khanna in talking about the Trump administration's intent to ban all flavored e-cigarettes from the market. The administration's ban clearly states that mint and menthol will be included, and I just wanted to get this answer on the record. Mint and menthol are, of course, flavors, correct?
Correct.
Yes or no? To be effective, do you agree that the flavor ban needs to include mint and menthol?
Yes.
Thank you. I'm encouraged by federal and state efforts to ban flavors and e-cigarettes, especially as flavors continue to be a main driver of why youth are using these products. I want to do a special bit of acknowledgement in my home state, the Commonwealth of Massachusetts, our Attorney General, Maura Healey, and the leadership of cities like Somerville and Cambridge. Even worse, 63% of Juul users ages 15 to 25 have no idea that the product contains nicotine. They think it just has flavors. A dangerous misconception considering that all Juul products deliver nicotine, and according to the company's website, a single Juul pod is equivalent to smoking 1 pack of cigarettes. Dr. Schuchat, are you familiar with the term nic-sick?
No, actually.
What about nicotine poisoning?
Yes, yes.
Can you describe how these symptoms might present themselves in children with high intake of nicotine?
You know, the variety of symptoms that can occur from extremely high levels of nicotine is scary. The specifics I'll probably need to get to you, but I think that we are aware of a number of poison control calls related to e-cigarette use in sort of overdosing, if you will, and then in terms of seizures having been reported as adverse events, but the specifics of that I'd have to get back to you.
And do you know what impact are the harms of high-dose nicotine when it comes to adolescent development? We've talked about how it might more acutely present, but what's the impact on adolescent development?
Yeah, the concerns about the developing brain in adolescence are that nicotine can lead to difficulty with memory, learning, and attention. It can also prime the brain and prime the body for addiction to other substances, and that's of particular concern.
All right. And then I'm just curious, have any states that the CDC coordinates with observed improvements in any of the 530 confirmed cases since they fell ill? In other words, are you noting any improvements for those that have been diagnosed with a lung injury? And what best practices would you recommend to states and hospitals as they begin to track long-term impacts?
Yeah, we know that in small numbers, the use of steroids during treatment may improve outcome, but we don't have scientific data or large-scale numbers yet on that. We're recommending right now that clinicians individualize care, but they consider the use of steroids in terms of its benefit and its potential harms. And sometimes steroids can be risky if you do think there's infection going on. We also recommend that clinicians follow patients after discharge, including with pulmonary function tests, to see whether the lungs really come back fully to what you'd expect in an otherwise healthy young person. And then clinical communities are gathering the data to come out with more official recommendations.
Thank you. You know, no matter what you call it, juuling, vaping, smoking, it's all the same. And a new generation of young people are becoming addicted to nicotine through these kid-friendly flavors. And we have no idea truly the long-term impacts this will have. As a mother and a lawmaker, I find this frightening. I yield back.